Well, we recently had the generic imatinib come to the U.S. We've had it for about a year and a half, and obviously that's an important component to the treatment because of the cost considerations. The cost hasn't been as low yet, but we expect that over time it'll continue going down and it'll become more of an advantage for the generic imatinib. But the questions that are being addressed, and there's a few abstracts in this meeting, is does that generic imatinib work as well? Are there any concerns about that? Because what we're seeing is that in many instances, patients are having to switch to generic imatinib because of the recommendation from third-party payers and things like that. And there's two studies, and they're a bit conflicting that I would mention. One is a study from Canada where they've had the generic for a little bit longer, and they matched patients who stayed on the brand imatinib and others who switched to the generic, and they report that there is more adverse events and more discontinuation, particularly because of intolerance with the generic imatinib. So they sort of suggest that one should be a bit cautious with the use of the generic, and that those things could happen in some patients, not in everybody, of course. We are presenting a study where we have been following the patients that switched to a generic imatinib to see if we see any changes in their response or in the toxicity profile that they're experiencing. And this is observational, but just seeing what happens as they switch. And in our experience, we have not seen any major changes in the toxicity profile. We don't see any new adverse events, anything that worsens or anything like that. And we are seeing that the patients that maintain the response that they were having. We need to follow this longer. We need to see more patients, etc. But I think at the moment we think that it's probably a good alternative. But because there's some discordant results, one has to be cautious still, and at the very least monitor the patients closely to make sure that there's no other issues that come and manage them appropriately if that were to be the case.